Hello, everyone. My name is Robert Johnson, student of Nightingale College. Today, I will be performing a video skill for you. It will be the video of intramuscular injection, right? So first things first, I just get to the facility, and before you touch any medication or do any type of patient care, you always need to do hand hygiene. I'm using the alcohol gel hand sanitizer, right? So I am going to first compare the doctor's orders. I'm sorry. Let me a little housekeeping notes. I am wearing my uniform, my school ID, and pants and shoes as well. Right? Okay. Continue. So I'm going to compare the electronic health records with the doctor's orders, and what I'm doing is I'm going to be comparing the 6 rights. Also, after I'm done checking the electronic health records and the doctor's order, I will then compare the electronic health records with the MAR, right? And I'm checking the 6 rights. And what those 6 rights are, I'm ensuring that it's going to be the right patient, the right medication, the right dosage, the right time, the right route, and the right documentation, right? Those are the 6 rights, checking in those 3 areas, which is going to be electronic health records, the doctor's orders, and the MAR. Now from there, I'll go ahead and go to the medication drawer, hand hygiene before touching medication, right? And I'll compare the medication to the actual medication to the electronic health record. I'm sorry, medication to the MAR. I'll compare medication to the MAR. And what the order, the doctor's order says that I am to administer 6 milligrams of morphine sulfate. On hand, what I have is a 4, the bottle I have on hand is a 4 milligram morphine sulfate per ml. And because of that reason, I have to convert and calculate everything to mLs because that's going to be the syringe I'm going to be giving. And what I did was my dimensional analysis is here, right? So is ml over 4 milligram, and then it's going to be 6 milligrams over 1. This one here is what I have on hand. This is the doctor's orders, and I'm just going to cross multiply, and then divide. And the outcome, what I'm going to be given, is going to be 1.5 milligram. I'm sorry, 1.5 milliliter is what I will be administering. 1.5 milliliter. That's what I will administer, right? Okay, that is my dimensional analysis. Okay, then from there, the syringe I'm going to be using for this skill is going to be a 22 gauge, or a 22 gauge 1.0 needle with a 3 ml syringe, right? Now, I will go ahead and gather my gloves, my syringe, my needle. I have gauze, and I have 2 alcohol wipes along with the morphine sulfate medication. I'll take my items to the patient's room. I will introduce myself to the patient, tell the patient why I'm here, and, of course, who I am. So knock on the door. Knock, knock. Hello, Mr. Jones. My name is Robert Johnson. My name is Robert, student from Nightingale College. And the reason why I'm here is that there's an order for you to have an injection of morphine sulfate for your pain. But before we begin, let me go ahead and pull the curtain for your privacy. And let me wash my hands at the sink. Items that I place in the patient's room, always put down on a clean, dry surface. And always keep your eyes on the item so nothing walks away, nothing missing, or anyone even touches it, including the patient. Never know. All right, so wash your hands, right? And then from there, Mr. Jones, now that my hands are clean, I'll go ahead and ask for Mr. Jones' wristband. And I'm going to have Mr. Jones verify his ID by verbalizing what's on the wristband. Mr. Jones, can you tell me your birthday? And tell me your full name and your birthday. Okay, Raymond Jones, birthday, March 5th, 1955. Thank you, Mr. Jones. Right, as I stated, Mr. Jones, I'm here to give you a morphine injection for the doctor's orders there. And I guess you said something about having pain earlier. So I would explain to Mr. Jones the reason for this. The use of this medication is to treat mild or severe pain. I would also explain to Mr. Jones the common side effects, which includes constipation, nausea. I would also tell Mr. Jones how the side effects also include drowsiness, right? Adverse reactions for this medication includes tachycardia. It can also reduce your respirations, slow down your breathing. Also, hypotension is another side effect for this medication. This medication can also cause dizziness and confusion. I would inform Mr. Jones of that. Then I would ask Mr. Jones, do you have any questions about this medication? No? Okay. Now from there, I want to ask Mr. Jones, Mr. Jones, do you have any allergies, any seasonal allergies? Are you allergic to any medication, any foods, or any seasonal allergies? No? Okay. Mr. Jones confirming he has no allergies. If I haven't done it yet, I'm going to go ahead and compare his ID band with the electronic health records. That's just checking the 6 rights again, making sure that this is the person once more. And everything looks good. So as I said before, I'm checking the 6 rights 3 times. Once was at the med card. Now it's right here in the room. And I will check it again the 3rd time before I get the medication. Right? Okay. So from there, I will go ahead and prep my syringe and my needle. There we are. There. Let's take the needle out. And let's put this one here. And I'm going to put that one there and twist that on, secure, that's on. Now, let's put my gloves on. Oh, let's see, let's do hand hygiene again. Although I did hand hygiene right before, but maybe I'm just being a little too cautious here. I just did hand hygiene. Yeah, so I'll go ahead and put those gloves on. Okay, and okay, now from there I am going to wipe down with my alcohol wipe down the top of the medication bottle. Right, just wipe that down. Good. I'm going to let that air dry. Right, let that air dry. Let's put that there on the side. And from there, and Mr. Jones, when you receive this injection, it's going to be like a kind of a stinging sensation. There are 3 areas that you can choose from or where you want to have this injection. You can choose in the deltoid area. You can choose on the side, your vastus lateral, or you can choose on the ventral gluteal. That's just like the upper hip muscle right there, the ventral gluteal, right? Mr. Jones has chosen the ventral gluteal for the injection, so that's where we'll give him his injection. Let's see here. Once again, like I said, you will feel some stinging sensation there. So I am going to pull out 1.5 mLs of air. I'm going to leave it the cap on the syringe, and I'm going to pull in 1.5 or draw up 1.5 mLs of air. Now I'm going to remove the cap, and I am going to make sure I keep the cap close by. I'm going to inject 1.5 ml of air into the bottle, medication bottle, right? 1.5 ml of air. Now I'm going to invert the bottle, and that's the amount I'm going to pull out. 1.5 ml of medication, right? So 1.5 mLs. Now from there, I'm going to tap on the syringe, making sure there's no air bubbles. Luckily for me, there's no air bubbles on this. Because this is not a medication that I have to mix, if there was air bubbles or too many, it would be okay to actually push it all back into the bottle and then withdraw, but that's not the issue here, right? So I'm going to remove that there. And because I still have to prep the patient, I am going to go do a one-hand sweep to recap the syringe for safety reasons, so I don't have to worry about poking myself. That's back on. And I'm going to show you the 1.5 mLs of what I just drew up. 1.5 mLs. All right. Okay, good. So from there, I am going to have the patient turn over to his side and position the patient. I'm going to use the heel of my hand, and I'm going to press down on the greater trochanter, right? Then with my thumb, it's going to be pointed towards the groin of the patients. With my index finger is going to be pointed towards the iliac spine, right? And my middle finger is going to be pointed towards the iliac crest, forming a little triangle right here in the middle. That's the area I'm going to be giving this injection, right? Right in that little small triangle area. But now that I determine where the injection is going to be, what I'm going to do is I'm going to inspect that area. I'm going to first look at it, looking for any type of lesions or anything like that, any discoloration, redness. I'm also going to palpate the area. I'm going to feel that area, making sure there's nothing wrong there, no swellings, no bumps, anything unusual there. Everything looks good on the patient's skin. The patient had voiced that he doesn't feel any pain there. Okay, so from there, I'm going to prep that area by using alcohol wipe. Once I wipe it, I'm not going to touch it. Circular motion, start at the center and work my way out 2 centimeters, right? I'm going to let that air dry. Now, the syringe I'm going to hold with these 2 fingers here, and I'm going to come down in 90 degrees. But before I even give that medication, I'm going to do one last check of that, of the 6 rights, right? Now that I got the medication here, once again, medication is in that syringe. I want to check one last time, looking at that. Then also, because I use dosage calculations, some facilities may have you actually get a coworker, a fellow nurse, to come in and verify the amount that you calculated, making sure it's the right amount. They're going to compare that with the MAR as well. My coworker just came in, fellow nurse came in and did that. And yeah, we're going to go ahead and I'm going to go ahead and give this injection, right? So everything looks good with the 6 rights. That's my 3rd check. So I'm going to use the palm of my hand and place that down on the areas that I mentioned, the greater trochanter, and I'm going to form that triangle that I was telling. Oh, let me first. There we go. Palm of my hand. Hold the syringe like this, and I'm going to come in 90 degrees. I'm going to squeeze that muscle area there. 90 degrees, kind of firm. And Mr. Jones, going to be like a stinging sensation. Here we go. Take a deep breath. 90 degrees. And before I even inject the medication, I'm going to wait a bit, and maybe about 5 seconds, I'm just going to aspirate on the syringe. Make sure there's no blood that comes back. There's no blood in that syringe. Okay, good. So I am in the right spot. If there was blood, that means I injected it in the wrong area. But yes, no blood, so that means I am right there in the muscle. I am going to use my index finger of my non-dominant hand and my thumb just to secure the syringe. And now I'm going to go ahead and slowly press that in. Okay, 10 seconds per ml, putting that in slowly. Good. All right. And getting my alcohol ready. And I'm going to remove the syringe and put the alcohol right above it. Not going to massage it. This goes right into the sharps container. Syringe is in the sharps container. That's in there. That's good. And then from there, I'll check on the blood. There's no blood, no bleeding, anything like that. Okay, good. Then from there, I'll clean up the area. Ask the patient if he's okay. How's he doing? Then I will give the patient a call light. Get my medication out of here. Over there. Give the patient a call light. Take off the gloves. Perform hand hygiene. Right? And then, after performing hand hygiene, I will go and document the care I provided. Thank you very much.